Assessment 2, Real Life Ethics, the Patient Suicide Attempt and Ethical Dilemma Case Study. What is ethics? Ethics is the study of what is valued, what is right or wrong, and good or bad for human beings. It is also defined as a normative science of the conduct of human beings living in societies, and judges what is right or wrong and good or bad. What ethical issues do nurses face? Nurses face many ethical issues in the profession, and it has been found that the top 5 issues faced are protecting patients' rights and human dignity, providing care with possible risk to your health, respecting and not respecting informed consent to treatment, staffing patterns that limit patient access to nursing, and the use and non-use of physical or chemical restraints. Code of Ethics for Nurses. Nurses follow 8 codes of ethics in their profession, which are 1. Nurses value quality nursing care for all people. By valuing quality nursing care, it involves taking responsibility for the standard of nursing care that they provide, helping to raise the standard of nursing care, and taking action when they consider, on practical grounds, that the standard of nursing care to be unacceptable. 2. Nurses value respect and kindness for self and others. Valuing respect for self and others embodies valuing the moral worth and dignity of oneself and other. This includes respecting the individual's ethical values that people might have in the context of healthcare. 3. Nurses value the diversity of people. Valuing the diversity of people requires nurses to be appreciative of how different cultural backgrounds and languages may influence both the delivery and receiving of nursing and healthcare. 4. Nurses value access to quality nursing and healthcare for all people. Valuing nursing and healthcare for all people requires nurses to sustain the principles and standards of the right to nursing and healthcare as measured by the availability, accessibility, acceptability, quality, and safety of nursing and healthcare services. 5. Nurses value informed decision-making. Valuing people's interest in making free and informed decisions, such as people having the opportunity to verify the meaning and implication of information being given to them when making decisions about their nursing and healthcare. 6. Nurses value a culture of safety in nursing and healthcare. Valuing a culture of safety involves nurses vigorously engaging in the development of shared knowledge and understanding the vital importance of safety in contemporary healthcare. 7. Nurses value ethical management of information. The generation and management of information must be performed with professionalism and integrity. For this to happen, the information needs to be recorded accurately, be non-judgmental, and be relevant to the healthcare and treatment of a person. 8. Nurses value a socially, economically, and ecologically sustainable environment, promoting health and well-being. Nurses value strategies aimed at preventing, minimising, and overcoming the harmful effects of economic, social, or ecological factors on the health of individuals and communities. What is the case about? This case looks at 57-year-old Mr. Green, who was diagnosed with aggressive prostate cancer 7 years ago. At the time of diagnosis, Mr. Green refused to have medical and surgical treatment. Instead, he looked at other options for treatment and never went for a follow-up appointment with the urologist. He presented at the hospital with symptoms of anemia, and after many tests, it came back that Mr. Green's cancer had spread to his bones. They also found that it had spread to his lymph nodes, and a primary tumour was attacking the bladder and moderately obstructing the left kidney. After the initial admission, Mr. Green had several various admissions, but on his last one, he was told that he may only live another 4 to 6 weeks, after tests showed that the tumour had grown and that any other treatment would not be appropriate, and that palliative care was the next step. While Mr. Green was in palliative care, he realised that he was going to die and expressed this to a nurse. After expressing this, Mr. Green disclosed to a nurse that he was going to kill himself, and the nurse was not to tell anyone else. Ethical concerns it raised. In this case, there are ethical dilemmas that arise in relation to what Mr. Green disclosed to the nurse. By asking the nurse not to disclose the information about attempting suicide, it puts the nurse in a difficult situation. There are 2 main moral choices that the nurse can take, but both have negative outcomes. The first one involves keeping the secret and respecting the patient's rights, but the outcome would be negative as the patient may commit suicide when intervention could have helped him. But on the other hand, the nurse could tell other healthcare members about the patient's suicide attempt and prevention methods could be put in place, but Mr. Green's autonomy, confidentiality would be dishonoured. The parties involved. The parties that were involved and impacted by this case was Mr. Green, the healthcare team, and Mr. Green's family. Ethical principles and theories. A Autonomy is one of the primary ethical principles and is relevant in Mr. Green's case as it demonstrates respect for the individual by allowing him to make his own decisions, which is the practice of informed consent. This principle gives him the right to exercise his own autonomy of his treatment and therefore respecting his choices. Nurses need to make every effort to ensure that the person understands the purpose, benefits, and risks. Likewise, respecting the autonomy of the individual is ensuring the confidentiality of a person's individual details and information. Mr. Green disclosed information to the nurse and told them to keep it a secret, and that if a nurse was to tell another member of the healthcare team, then it would be breaking the individual's right for information to be private. But keeping Mr. Green's secret and respecting his autonomy may not be beneficial to him, as it may lead to the patient's behaviour of self-harm. This links with beneficence and non-maleficence, which looks at keeping the interests of the patients in mind by doing good and not doing any harm to the individual. It is the nurse's duty of care to ensure that the patient understands the benefits and risks of treatment or choice. The principle of beneficence is relevant to this case as it prevents harm from happening, and in Mr. Green's case, the nurses can benefit him by removing him from the environment that may cause him to self-harm. It is in Mr. Green's best interest for the nurses to have a healthcare intervention to prevent him from hurting himself. Non-maleficence is a relevant principle for this case, as the nurses have to ensure that there is no harm to the individual. This principle allows for Mr. Green not to be intentionally harmed in the decision. The nurses and nursing team must ensure that they do not intentionally offend or cause suffering. If non-maleficence is not applied, then the patient may self-harm or become a danger to himself and those around him. Non-maleficence must be balanced with beneficence while providing care. Utilitarianism. This theory can be used to determine a better moral decision. This case affects three main groups of people: the patient, Mr. Green, his family, and the healthcare team, but more people would benefit from the decision made. There are two moral choices that benefit those involved in the case study. The first choice is to keep the secret, which will cause the patient to commit suicide. This choice would only benefit Mr. Green as it is wished to die. When a family members or friends have someone close to self-harm, it has been found to have a negative impact and that they feel guilt or shame. Therefore, this choice would only benefit Mr. Green and would not be the right moral choice. The second choice of the nurse telling other staff members would benefit his family and the healthcare workers. This could be done by developing an intervention plan. Having an intervention plan, it will lengthen Mr. Green's life and ensure that he is safe. Research has been found that family members are more happy and grateful if they are able to spend more time with their relative who is sick. Therefore, telling the healthcare team about Mr. Green's secret would benefit more people in the long run. How was the ethical issue resolved? In Mr. Green's case, it was appropriate for the nurse to share information about Mr. Green's suicide attempt with other healthcare members. Once the nurse was aware of Mr. Green's suicidal thoughts, they were able to provide psychological comfort to the patient, with trying to stabilise his mood and prevent his suicidal behaviour. The nurse passed the information about Mr. Green's thoughts to the nurse manager. A nursing team was instantly developed with 2 nursing members and the head of oncology department. The nurse manager followed the self-harm and suicide protocol of the hospital. For Mr. Green's condition, she separated the suicide protocol into 3 steps. The first step was effective communication, where one of the nurses was responsible for maintaining active communication with the patient to stabilise Mr. Green's mood to prevent suicidal or self-harm behaviour. The nurse discussed with Mr. Green of what is causing his thoughts of suicide. Once the nurse found out the reason behind his thoughts, step 2 of purposeful nursing intervention was put into place. A systematic pain assessment was conducted for the patient by nursing staff, and a physician was informed so that Mr. Green's pain medication could be adjusted. Once his pain medication was under control and the patient was in a stable mental and physical condition, the third step of collaboration with other healthcare providers was developed. The other healthcare providers in this team included psychologists and a social worker. The psychologist conducted a psychological evaluation to assess the other risk factors associated with Mr. Green's suicide thoughts. A psychological plan was developed by the psychologist and the nursing team. After the protocol was completed, Mr. Green's physical and mental state was stabilised and he did not express feelings of self-harm anymore. Recommendations. Some recommendations for nurses when dealing with ethical dilemmas such as patient suicide attempts are training and education. More training needs to be done for nurses so that they can cope with situations like the case study. Training can allow for strategies and knowledge to be taught, which allows for the individual to become more confident in dealing with difficult situations. Training has been found to provide a drastic difference as it improves detection skills and increases their knowledge about suicide prevention. Education about the actual code of ethics is important as it influences nurses' behaviour towards situations. It has been found that education in ethics increases their behaviour and knowledge towards their professionalism in the workplace. Therefore, if they have the knowledge, then they can influence change and help the individual. Education also ensures safe, effective and contemporary care to patients.